All right, future nurse, let's dive into this NCLEX question of the day on medication orders. So the nurse is caring for an 84-year-old female with an uncomplicated urinary tract infection. Which of the following orders would the nurse verify with the healthcare provider? Select all that apply. And remember, when we tackle select all that apply questions, we go down the list of answers and do it as a true or false. So if you want to pause the video now and see if you can answer this question independently, and then I'm going to run through it with you. One more thing I want to remind you, when you're taking the NCLEX, you're only going to be seeing the generic medication names. So you'll be seeing the first name, not the second, the one in the parentheses. So option A, we have amoxicillin clavulanate, which is Augmentin. You won't be seeing Augmentin, but you'll see the other name. This is an antibiotic, and it's 875 milligrams. Oral tablet every 12 hours for 7 days. Now, this is a pretty good prescription. It seems to fill in all of the requirements. We have the drug name, the dosage, the route, the form in which it's going to be given, tablet, the time, which includes every 12 hours for 7 days. So this is not an answer choice because this is an appropriate prescription. All right, let's move on to option B. So we have acetaminophen, 650 milligrams, intramuscular every 4 hours, PRN, which is added as needed for pain or fever for 5 days. Now, if you selected this as an answer as something you need to verify with the provider, you are correct because we do not give acetaminophen intramuscularly. We can give it IV, we can give it PO, or we can give it in the form of a rectal suppository. Now, everything else in this prescription is accurate. However, the route in which you administer is inaccurate, and this is something that you need to verify with the healthcare provider. Let's move on to option 3. We have morphine, 15 milligrams, oral route, every 3 hours, PRN for 5 days. Now, if you selected this as an answer choice, you are also correct. This is something you need to verify for multiple reasons. But the main first things first is we have 3 hours PRN for morphine, but no indication for what we need to give it for. Typically it's pain, but you need to see that on the prescription in order to know when am I giving this medication. Now, and if we look at the information of the client that was given to us in the question, we have an 84-year-old female with an uncomplicated UTI. First off, 84 years old with a morphine is a fall risk. There's no prior history of any opioid medication given. So this is something that I'm going to want to verify with the provider. It doesn't mean that it's not warranted, but something we're going to need to verify. And option D, this is not an answer choice because it is an appropriate prescription. Everything is accounted for that we need to know, and it is indicated in an uncomplicated UTI. Follow for more.